More healthcare workers are calling it quits as COVID-19 takes a mounting toll. Resignations have picked up pace since the start of the pandemic. At the same time, ICU bed capacity is being increased to prepare for more cases as the country reopens. Sherlyn Sia reports.
Hospitals are filling up, with about 9 in 10 beds in the general wards now occupied. Over in intensive care, COVID-19 patients have filled up 60% of beds set aside for them. To prepare for a potential rise in severe cases, ICU bed capacity for this group will be increased from about 220 to 280, which can be ready this week. And if needed, it can go up to 350 next. Sharing the update in Parliament, Senior Minister of State for Health Janil Puthucheary says there's a limit to further expansion.
Logistically, we can keep stepping up our ICU beds. We have ventilators, we have equipment, consumables, all the things that are needed, but not enough people. As a result, if we keep increasing our beds, we stretch our healthcare workers. We will come to the point that they will no longer be able to provide that continuous excellent care.
To add to the manpower crunch, Dr. Janil, who was a doctor in the children's ICU for over 10 years, says the sector is seeing more resignations. About 1,500 healthcare workers left in the first half of this year, compared to about 2,000 yearly before COVID-19. Among them, nearly 500 foreign doctors and nurses quit in the first 6 months of 2021, as many as the whole of last year. To plug the gap, the Health Ministry is redeploying manpower and reaching out to volunteers. Private hospitals have also been roped in to ease the load. Dr. Janil warns Singapore cannot divert too many resources from non-COVID patients, even as COVID-19 healthcare capacity is being built up ahead of any future surge in cases.
If you have nurses, doctors, beds ready for only to accept COVID and not to accept all these other conditions, we will see an increased death rate. What we are hoping to do is chart a middle path, ramp up capacity just ahead of demand with enough time to give the staff some degree of orientation, training, and be ready for when the surge comes in. But not so much that we end up sacrificing the rest of our healthcare system.
Although most patients recover fully from the coronavirus, he says Singapore has detected 32 reinfected cases, all unvaccinated. Responding to queries from the House, Health Minister Ong Ye Kung says the majority of COVID-19 transmission still happens within the community. And when someone tests positive, about 10% of household members subsequently get infected.
But out of that 10%, 8 percentage point get it the moment very early on, suggesting that actually they got it at the same time as the index case. Yeah. And then during the subsequent days, another 2 percentage point then got transmitted. The incidence of transmitting at home, so long as you take the precautions, actually is not high.
The ministry says it will make sure patients get good care to prevent as many deaths as possible. Singapore's death rate is at 0.2% compared to 3% or higher in countries where cases surged before vaccination.